My name is Barbara Scott, and I have the honor of serving as the CEO of Aspire Indiana Health. And today is an amazing day for us. It's a long time coming for those of who actually worked on this project. And I don't know about you, but this was maybe not the smartest idea, was to do a major expansion of a capital project during COVID. But then again, there was no one here. And so it was easier to get it done that way. So before we go into brief comments, today we're going to keep this short, although it is really nice, and I would rather be here than in the office. I do want to acknowledge, it takes a village to build a building, and we have some people we want to thank for being part of that. So instead of making you come up, because everyone, it seems like we work with, our introverts, at least raise your hand when I acknowledge you. So we had another capital project, which we did at the same time in a different county during COVID. And so what we first want to thank are our board members, because we cannot do anything without them first understanding the mission and approving any kind of capital expense for that. So if you're a board member, and I have my board chair, and he's standing right over there, Mike Collette, thank you so much. Dwayne Hope, thank you so much for representing the board. Oh, I'm sorry, I'm Trent. Trent Scott, also a longtime board member and resident of Hamilton County, so thank you so much. And you're wearing your uniform, that's why you're being here. I want to thank our facilities team members who do a really heavy lift during this project. They often wear Aspire hats, so I'm looking at Joe. And your name's on my head. I'm like a mother who thinks, Dwayne, I know Dwayne. It's just, this is what happens. Brian, thanks. How many buildings do we have again?
We're at 55, almost 56.
We have 56 buildings, and so they're trying to maintain that while we're also growing and expanding. So thanks, team, for that. David Wildman, who is our controller, who happens to do / facilities, and does a really good job with that. Thanks. Also want to thank anyone who is part of the operations here, whether you provide direct service, or you do administrative support, whether it's here in our building here or elsewhere. Raise your hand. I know we have a lot of you. None of them are raising their hand. I'm looking right at them. Okay, well, just go unknown. Very good. Oh, healthcare people. So I want to thank a couple of firms that helped make this possible. Greg Lewis, Vice President of Artecna, there he is. We have him on retainer. He and Elizabeth Gruber do a great job for us. Thank you, Elizabeth. The Worcester team, anyone here from Worcester? Thanks, Jim. Thanks all for being part of that. And Colliers, our project management. Sean, Dick, thanks for being here. So we have some VIPs. If those are not the only VIPs in the audience, we have some others. So I do want to acknowledge Chuck. I was making fun of him earlier. Haberman from the city, economic development. Mayor Jensen was unable to be here today. He was part of our, groundbreaking ceremony that, I don't know, it was like 7 years ago for this project. So he hated not to be here today. And thank you to him, because by the way, he has a lot of not-for-profits not paying property tax in his city. So got to thank him for that. We have Mary Allen, for Outreach Coordinator from Victoria Sparks, Representative Sparks' office. Thank you very much for coming. For you that don't know, Victoria actually resides here in Noblesville, so we are her local provider. We have Monica Kozlowski. Sorry, Monica, your name. So sorry. from Todd Young's office. So thank you so much, Tom. Thank you for allowing me to come. And oh my gosh, good friend of Aspire, good friend of all things public health as well as mental health, is Representative Donna Scheibele. Thank you so much, Donna, for your support. Check out the Hamilton County Reporter. She's got a great article in it today. And especially the part that she mentions Aspire. So thanks. And of course we have Senator Kreider here, but before I introduce you, Senator Kreider, because it's you and I doing the speaking, I want to share a couple words. So we're here today to celebrate not only the expansion of this beautiful facility, but it's really to educate our community about how this facility is just a piece of an entirely new operating system coming to Noblesville, to Hamilton County, to the state of Indiana. I'm going to talk about that. So Aspire Indiana Health, we're really a very complex, multi-corporation ecosystem that has learned to integrate all kinds of services in an attempt to better serve people with complex medical, psychiatric, and social needs. That's our sweet spot. This facility offers all of those integrated services in one location. So, including primary care through our federally qualified health center, we swim in acronyms, behavioral health and social services through our community mental health centers system. And while all that sounds fantastic, it's only part of our story that continues to evolve. And this is where I get emotional, because there's just so much promise for the residents of Indiana. So as we stand here today, our mental health system is changing in Indiana. Aspire, along with all the other 24 community mental health centers that serve our 92 counties, are partnering with our mental health authority. It's called Substance Abuse Mental Health Service Administration, SAMHSA, another acronym we like to swim in. So SAMHSA is partnering with states across the country and here, Indiana, to transform our services and our entire mental health system. So Aspire is becoming, I'm going to give you another acronym, a CCBHC, a Certified Community Behavioral Health Center. I'm going to talk to you about what that is. It is a federally designated, right now, as a CMHC, we are a state designated community mental health center, which means Indiana has to figure out what they do, and Nebraska has to figure out what they do, and Wisconsin's got to figure out what they do, and there's no national certification for what we do. And you know what happens when you get a national certification, besides a lot of regulations? You get Congress to wake up, and they see, oh, wait a minute, there's a thing that we can wrap our heads around, and we can fund, and we can support. So it's a specially designated clinic that receives flexible funding instead of our archaic, rigid, underfunded system that we have today. It's going to be able to expand the scope of mental health and substance use services available in our communities, either directly through, like Aspire, or through partnerships that we can literally, really partner with and help pay for those partnerships. I have some handouts for those of you who are interested in learning more, just beginning to learn more about CCBHC and what it means for our community. But before we do that, I want to introduce Senator Kreider. So Senator Kreider has been really an influential legislator in mental health and addictions. He's fully on board with 2 national transformations, and I just told you one of them, including that CCBHC model and our 988 infrastructure. So these 2 things are going to give individuals experiencing a psychiatric, 988 is going to give individuals, let me think about it. I just wanted you to pause for a second. Ralph, when you call 911, without a doubt, what do you know is going to happen? There is going to be a response. There is either going to be a law enforcement response because you just reported that there's someone with a gun at your door, or there's going to be an EMS response because your neighbor has fallen over in the driveway and you need a medical help. You know that. And you also know that that response is going to take you or your neighbor somewhere to get what you need, right? 988 is that same thing. It's a paradigm we just don't have in our head yet about what it is capable of doing. So 988 is a number to call, and I guess it was huge nationally for it to be a 9 number. Like you can't just get a 9 number. Someone to respond, and that someone to respond is going to be a behavioral health response. So not law enforcement, when all they really can do is figure out if I can arrest you or take you to the hospital. It's about all they can do. But it's someone who can de-escalate the situation, connect people to what they need, and then a place to go that's not a jail, and it's not an emergency room, but it's actually, if you do need to be stabilized with your crisis, there'll be places to go. That does not exist today in our infrastructure, but all that will come. And I think it's going to take, and Senator Kreider, you've got the magic bulb. I'm going to say a minimum of 5 years. I'm going to say probably more like 5 to 7. But anyway, and that's like tomorrow. So these 2 models, the new mental health system and 988, will permanently change how and when people access mental health and substance use treatment services in our communities. And if we succeed, as other states have done, they are demonstration states around the country who have gone a couple years before us, and we will find that our mental health service landscape is changing, improving that high quality, evidence-based clinical care, when supported with effective financing, they can dramatically increase access to care and provide services nationwide to people. There are some states experiencing, some local communities experiencing a decrease in their jail population. Ralph Watson is Community Corrections Executive Director here in Hamilton County, by 60 and 70%. That's phenomenal. I hear that and I think, really? Okay. That was not yet my introduction to Senator. But however, now the pressure's on because I just sold this and he's carrying lots of legislation. So with that, I would like to introduce Majority Whip, Indiana State Senator Michael Kreider from District 28. Okay, wait a minute. You don't know what he's got done. I don't know, I'm not very political, as if you can tell. And I didn't know what majority whip really means. But do you know what that means? Oh my gosh. He's the 3rd highest ranking individual in the majority party. So now I'm really nervous. In some of his committee work, Homeland Security and Transportation, he chairs this. Veterans Affairs, which by the way, CCBHCs have a mandate to serve veterans better. There's been a disconnect between what we're able to do in veterans. Appropriations, that's very important. Health and Provider Services, rules, and legislative procedure. Absolutely thrilled for you to be here. Thank you.
Thank you.
Thank you, Barb, and thank you all for showing up this morning. It's great to see so many folks that I've
met over the years as I worked on legislation related to the mental health challenges, and certainly great to have Representative Shively here, who is a great colleague in the House when we have bills that move back and forth. Barb is one of those individuals that I have gotten to know better as we've worked on legislation. She was part of a about 6-member group that showed up 2 years ago, met with me and said, can we try something new? Can we start to think about something new? And we created the Behavioral Health Commission during that session. And I'm sure Barb can connect you with the report that was generated from that group. But basically we used providers from all levels of the system across the state. We used the state government Division of Mental Health and Addiction. We used folks from the justice system, academics to try to quantify the challenge that we have in the state. And you'll see in the report, if you look at it, the cost of untreated mental illness is estimated to be about $4 billion annually. And so it's a big problem. We didn't get here overnight. We're certainly not going to get out of this overnight. But this next legislative session, I'm going to be trying to prepare legislation based on recommendations from that report. One of those recommendations is to institute a dollar fee, kind of like what we use on the 911 system. And that would generate about $90 million a year. And I'm hopeful as part of the budget process, we can add some money to that. And within that bill, there will be a list of allowable uses for that funding. One of the things that Barb mentioned this several times is certified community behavioral health centers, more problem-solving courts, things like a continued work with the community-based paramedicine program, the CIT programs, all those things that are pieces of this puzzle that's really, as Barb mentioned, it's very complex. Each individual has their own special needs, and I think I saw that during my experience following my law enforcement career. I ended up running the security department at the hospital in Greenfield. Really often I was that person after all the situation calmed down, sitting in the room with an individual that was in crisis, and I got to hear them begin to unpack their stories and really drove the need for changes in this system, ways to do this better than we've done before. Barb mentioned the number of buildings in these facilities, to the CFOs and all the other people to try to figure out how to pay for all of this. It's extremely complex. I've been an administrator in state government. I know how expensive these operations are. But really, my hope is at the end of this, this period, as we work through these changes, that we have a more sustainable funding stream, that we have buy-in from the legislators, that they will understand how important this work is. Last night, I happened to have the opportunity to participate in a fundraiser in my community in Greenfield, where I serve, for residential treatment. And listening to the participants in that program describe how that supportive care, that network of care, how that changed their lives and gave them hope, really kind of drove this point home again for me. And so to all of you folks that are involved, whatever level you're involved, whether you're a decision maker or whether you're a person that's providing direct care, thank you for your work. It is so important. And we're going to do what we can from the legislative level to try to get things passed that are going to make a difference for the state. Several states, as Barb mentioned, have kind of paved the way. I think the work the Behavioral Health Commission did recently, we had the Mental Health Summit, and the speaker from Florida said, I'm going to take this report back and just recommend that they change the name from Indiana to Florida. And so you can see that the work that was done has been substantial. I'm very proud of my role, small as it was, in helping get things moving forward. And I'm proud to know folks like Barb, who has really dedicated her life, and you can see she has the passion for this work that folks need to have. And so thank you very much for your time, and congratulations on opening your new facility, Barb.
Thank you. Lastly, we have, if Tim wants to, is Tim here? Yeah, he'll come. We, Representative Gregory Stewart from District 40, and he's a majority caucus chair. He was unable to be here today, but he is kind of tag teaming it with Senator Kreider on the House side, and also authoring legislation that's going to help move our system forward. He was really influential in this last session in telehealth bill, which allows, after the public health emergency, for us to continue doing what we do through telehealth. So we're really thankful for that work he did. And this year he's going to be introducing legislation that will help people serve people better who are in jails, who really should not be in jails, and allowing judges to get them out of jail and into treatment, as well as helping law enforcement completely deflect people from even entering that system. So really happy to hear from him as well. So Tim Crockett is our CFO, and he's going to read that letter.
Thanks, Barb. Greetings, Aspire Indiana Health team and friends. I am pleased to welcome you to the open house for Aspire Indiana Health's newly expanded and renovated space for primary care and behavioral health services. I regret that previously scheduled commitments prevent me from being there in attendance. Healthcare is essential, yet we know many individuals in our community with mental illnesses and substance use disorders far too often end up in facilities not equipped to treat these illnesses, such as emergency rooms, hospitals, local jails, rather than the treatment facilities such as what Aspire has to offer in this new space. I was honored recently to be able to participate in the State Justice 2022 Mental Health Summit that held Indiana's very first cross-branch multidisciplinary collaboration to bring collaborative solutions to true Hoosier communities, just like Noblesville and Hamilton County. These solutions include a mental health crisis response, or 988, a federal designated certified community behavioral health centers that utilize cost-based funding methodologies, which broaden what our community mental health centers have been able to do under our current funding system. I am honored to be able to support this work through authoring a mental health referral bill that will enable judges to remove individuals from jail and place them in a treatment center, as well as allow law enforcement to deflect someone entirely from the criminal justice system by accessing treatment alternatives. The commitment made by healthcare partners such as Aspire Indiana Health is helping make these community-centered solutions possible. On behalf of the legislative branch, I want to thank Aspire Indiana Health and all in attendance today for your commitment to providing essential health services to all Hoosiers. I look forward to continuing our work together in the next legislative session.
Unless anybody else wants to say anything, that concludes our speaking part, and I think we'll move on to the ribbon cutting picture opportunity. So if you want to hear more, we do have copies of that behavioral health. It's the crib note version, not the 60-some page version. The crib note version of the Behavioral Health Commission and all those things we just mentioned today. Take advantage of it, get your head wrapped around it. It's a new paradigm. It's really going to be hard for all of us to fully appreciate what our outcomes could actually be here in this local community. So thank you.